everyone, and welcome to another of our Heart for PCOS interview series. I am so excited to be sitting down with our guest today, Dr. Ami Patel. Dr. Ami Patel is a board-certified pharmacotherapy specialist and a licensed clinical pharmacist specializing in internal medicine and prevention healthcare. She is passionate about providing evidence-based education and empowering people to take control of their health. She is the host of the podcast and provides consulting on polycystic ovary syndrome through her company, PCOS Holistic Coach. Welcome, Ami. How are you doing today?
I'm doing well, Ashley. Thank you so much for having me here today.
Absolutely. I'm really excited to be sitting down and talking with you about what you do, not only as a pharmacist, but in particular about holistic healthcare, because I don't think a lot of people completely understand what that means. They usually think, oh, that just means eating herbs and plants and, doing yoga, but they don't really understand what holistic care really is. So can you describe what holistic care entails?
Yeah, definitely. So holistic care is looking at the root cause of a condition, like in terms of PCOS, looking at what causes it. And then the approach to managing it holistically is making lifestyle changes, but not only focusing on like exercise and nutrition, but also looking at your sleep and stress and mindset to manage it.
That's awesome. And why is it so important to treat the whole person as opposed to treating individual symptoms?
Yeah, so that goes back to like looking at the root cause. So, for example, if you are treating an individual symptom like acne, you can treat that like topically, or if a medication is prescribed like spironolactone, that can be used. But if the cause of that is something like inflammation and you have inflammation in your body and other parts, then you can have other symptoms. Like you can have like eczema, you can have like rashes and things like that. And so you want to address the underlying symptoms. So not only does the acne get better, but other parts of other symptoms get reduced as well. And then like going with like insulin resistance, that can also contribute to acne. But if you're only targeting the acne, then, you know, the patients can have other symptoms like hair loss or unwanted hair growth or abdominal weight, but that's not going to be resolved by, just applying like something topically for the acne.
Right. So it's really important to view all the different symptoms together, to get a comprehensive overview of what somebody might be dealing with and then treating it comprehensively. So as someone who
Exactly.
is not only a practitioner, but a patient, do you feel care is more comprehensive when we're able to look at different approaches and utilize different resources?
Definitely. So yeah, someone who's a pharmacist, looking at like the Western aspect of healthcare, but also like holistic healthcare, which is more kind of like Eastern healthcare and combining those two. So there's so many benefits to doing that because you can get like the medications and supplement or get the medications that are prescribed, but you can also have like the Eastern medicine, like the holistic healthcare aspect of it. And it's important to utilize all of these resources that we have. We shouldn't think that, if I just do, like, I should only do Western medicine or only Eastern medicine. There's nothing wrong with using what works for you and taking benefits from both sides. And because everyone's PCOS is individualized, like something that works for someone may not work for someone else. And just because it works for your friend, it may not work for you and vice versa. So it's important that we recognize that there are so many resources out there, like nowadays in modern world, like there's so many free resources, even on YouTube or the internet, like, just doing like meditations, breathing exercises, right? That's something that can be utilized. And if somebody needs help with like exercise, working with like a personal trainer, or if you need help with mental health, then working with someone like a therapist or taking medications for that. And all of that can help with improving your PCOS.
That's awesome. And I love that you do that integrative approach. I think that's so important. Can you talk a little bit, and I know I hadn't mentioned this before in our outline, but I think it's really kind of cool to talk about some of the differences between Eastern and Western medicine, like the philosophies.
Yeah, definitely. So one example of like Eastern medicine is, well, actually two examples, like Ayurveda, which is primarily from India, or like Chinese medicine, which looks at a lot of herbs. as well as like acupuncture. And so those things can be really helpful because they actually look at the person as a whole as well. And they try to, like with Ayurveda, there's like three different doshas that like everybody has a component of all three, but if you have an imbalance, then it can contribute to long-term conditions like PCOS. So the goal of Ayurveda is to kind of be balanced in your whole body to improve your symptoms. And then with like Chinese medicine, you can use acupuncture, which can be really helpful for like relaxation. It can even help with like regulating cycles, getting rid of toxins from your body, and just like moving stagnant energy. So there's lots of different benefits.
I think it's great that you're able again to like utilize all of these different philosophies, because I think it gives you a better care plan as far as like the choices that you can make to help you overcome PCOS. So at the center of holistic care is lifestyle modification. Can you talk a little bit about this and break down the principles of nutrition, exercise, and reducing stress?
So it's, individualized for each person, but we can cover like the basics or the starting point. So like one thing when it comes with nutrition, sometimes there's a misconception with PCOS that, you have to like eat no carbs or low carbs, but really what's sustainable long term would be something like you can eat carbs, but add something else to it, like a protein, a fiber, or a healthy fat, and that would help prevent some of the blood sugar or insulin spikes that can be caused with just consuming carbs. And then in terms of exercise, so a common question is like, oh, what's the best exercise for PCOS? But what I tell people is the best exercise is any exercise that you like doing and that you can, enjoy doing, continue doing long term. And the goal is just to get started with any sort of movement and trying to have a variety of exercise that you're doing. So it could be anything from like resistance training, yoga, running, swimming, hiking, dancing, anything that anyone enjoys. So I think, the hard thing with the stress part of it is that, like, with exercise, you can measure, like, okay, I worked out for 30 minutes 5 times a week. Or with nutrition, you can say that, I had 3 meals. But with stress, it's so hard to visualize and pinpoint that, my stress level is like this much. Or like, and especially if we're used to living with so much stress, sometimes we may not realize that how bad the stress is for us until it's actually reduced. And then you're like, oh, wow, I was really stressed out. It's just starting with that awareness and asking yourself, like, what are stressful things for you throughout the day, or how stressed are you feeling? And just asking yourself, like, what are things that bring joy to you and what are things you enjoy doing as a kid? And, that's like a great starting point for figuring out how you can reduce stress and what things you can do to reduce stress, because this is also something that's very individualized. And so those are just like some ways you can start. And then just like a really simple tip is something called like box breathing. And so basically you like imagine a box with 4 sides. And so you just like breathe in for 4 seconds, hold for 4 seconds, breathe out for 4 seconds, and hold for 4 seconds. So then you just repeat. But it's like so simple that you can like remember to do that anywhere, anytime. And, once you start practicing and incorporating that throughout your day, then when you are in like really stressful moments, you can go back to that.
Yeah, I love that because, one of the things that you kind of touched on is creating sustainability, because PCOS is lifelong. So we've got a long way to go to, to manage, to deal, to overcome with things. So yeah, really important points to find joy, find things that you'll have fun doing, and foods that you'll enjoy eating, because long term that's going to optimize your health. So beyond the aforementioned, sometimes patients' symptoms do not respond to lifestyle management alone. I would love you to talk about the use of supplementation, herbs, and medications you may incorporate into a PCOS care plan.
Definitely. So this kind of goes back to like, utilizing Eastern and Western medicine and all the resources that are available to us. And sometimes we have, that misconception that, I can only do one way or the other, or this is the only medication that's going to help me, or because it worked for someone, it's going to work for me. But, recognizing that PCOS is individualized and trying all the resources that work. So in terms of like medications, I know one of the big controversies is like birth control. And so keeping in mind that, you can take birth control if you want to, but just understand like why you're taking it. Like it's not going to help with resolving your PCOS, but it's going to help improve your symptoms. And if
Yeah.
that's what you're looking for, then that's totally okay. And at the same time, you can supplement that with the lifestyle changes so that, when you do come off of birth control, whenever you decide that is right for you, then you don't get those symptoms to come back. Like, birth control can help with improving your acne and like hair loss. But if you're not making any lifestyle changes while you're on it, then when you come off of it, you're most likely going to get, those symptoms to come back.
I was put on birth control pills at age 13, and I was told to stay on them until I wanted to get pregnant. And I never had a diagnosis of PCOS or, knew why I was on. I just knew I had to be on them. So when I came off them at age 29 without any preparation or anything, I put on like 100 pounds in 3 months and had the acne and the hirsutism, and everything came back. Like I was blown away. I was like, wow, something is really weird here. So it's really important that you touched on that, because I don't think people realize that along with your medications, you have to have that plan of care if things change, if your decisions on your care change. So thank you for sharing that. So since we are here celebrating the 10th anniversary of Heart for PCOS, I wanted to talk a little bit about prevention and the role of holistic care. So let's start with the big three: insulin resistance, inflammation, and androgen excess. All can increase risk for things like high cholesterol, high blood pressure, diabetes, and even cardiovascular disease. So how can holistic care play a part in being preventative and reducing these types of risks?
Yeah, so holistic health definitely addresses like the root cause, like we've been talking about, right? So, like making sure that like your nutrition and exercise can help with reducing insulin resistance, it can help with improving inflammation. And so, that long term is going to help you prevent developing those risks. And that's why, like, the lifestyle is so important, because we do want it to be sustainable. We don't want it to be like, for 12 weeks, you're on like a super hardcore like workout and diet, but then you can't maintain that. And yes, you may have gotten better during those 12 weeks, but if you can't maintain that, then, you're going to just slowly go back to the old habits and you're going to increase your risks again.
Yeah, absolutely. So how often should we screen patients, like blood work, vitals, do a physical exam, and note changes in health, so we can adjust things like lifestyle and medications?
It's a great question. So at a bare minimum, everyone should do it at least once a year. But if those that are fortunate enough to have access to healthcare and an insurance that can at least do twice a year, like every 6 months, that would be better, because 6 months is a good amount of time where you've implemented lifestyle changes and medications and you know whether it's working or not working. And if it's not working, then you can start implementing other changes. You don't have to wait that extra 6 months. And then, if it is working, then like to continue doing that. And if people don't have access to healthcare through insurance and things like that, there's lots of communities that have like health fairs throughout the year. So, just looking into those things and seeing where you can get, like your blood pressure checked, or a lot of them even have like on site where they can like prick your finger and see your cholesterol levels and your blood sugar and things like that.
That is so important, and sharing those resources is great. Thank you for that. So, what, if any, signs should we look for that can indicate someone may be at higher risk for health complications with PCOS? And specifically, like when looking at either blood work or doing a physical exam, like some symptoms that may appear that would indicate maybe we don't have things under control.
Yeah, so I think the important thing to remember with the like blood tests is that that's like a moment in time. And so what's more important is that having like the trending levels, like there's definitely like if there's a lab value that's like super high and it's, abnormal, then that for sure needs to be addressed. But keeping in mind something like HDL is known as like good cholesterol. And so you want to keep an eye on that and make sure for that one, you actually want more of it. So you want to make sure that it's trending higher. And one way to improve that is like cardiovascular exercise. So like for 6 months, if you're doing that exercise, but your level is continuing to go down, then, that's something that's a perfect example of like, okay, maybe I need to adjust my exercise regimen and see how I can change it up so that it starts going in the right direction.
Absolutely. So I wanted to shift gears a little bit because beyond being a practitioner, we talked about that you're also a PCOS patient and a fierce advocate, if I might add. So,
Thank you.
so for many, being part of a community and using our voices to empower ourselves and others can go a long way. You have been extremely involved in the PCOS community and advocacy. So how can community be an integral part of our well-being?
Yeah, I think, that community is so important and it can be helpful, but it can also be hurtful. And like from my personal experience being like a South Asian female in my South Asian community, things like, PCOS, mental health, infertility is like such a taboo subject and it's not talked about. And there's like a lot of blame on like the individual that, you have these things and it's because it's your fault. And so what's been really helpful is finding a community outside of my like South Asian community, and that's the PCOS community, which has been really helpful because I've been able to connect with other individuals that understand what I'm going through, and it also provides like the opportunity to be exposed to like more resources and just like learning from other people's experiences as well. So yeah, community is really important. It can be like harmful or helpful, and it's about finding the community that is helpful to you.
I love that. And I'm going to let everyone in on a little secret because it's something you told me earlier that you're actually going to be a regional leader for PCOS
Yes.
Challenges PCOS Advocacy Day this year. So, why does advocacy matter? And can you talk a little bit about your experience in the past with advocating with legislators?
Yeah, advocacy is really important because I think, a lot of times as patients that have PCOS, we get really frustrated, like, oh, why isn't there enough funding? Why do my providers not understand what I have and why can't they help me? And so this is where advocacy really comes in because it's about providing that education, about raising awareness and fighting for these things that we need in the community. So that's why I'm really passionate. And it's like if you want to see a change, you have to be involved with making that change, right? You can't just complain and say that, these are the issues and not do anything about it. And so being involved with PCOS challenge is like a perfect way where I can channel my frustrations into something good that, hey, like, we're working towards making this change for a better future.
Yeah, and it's so important because I think a lot of people don't understand how powerful their individual stories and voices can be, especially when we talk about going to Washington, D.C. and talking with legislators. Everyone's like, oh, I don't know. They're not going to, want to listen to my story. And what am I going to say? And the funny thing is that a lot of times that's exactly what they want to hear is the patient's story. So, why does PCOS awareness and being part of campaigns like Heart for PCOS and PCOS Advocacy Day matter to you?
I think touching on that point you just said with like legislators, what's interesting from the past couple of years where I've done it, like anytime we talk about PCOS, the first thing that most of them say is that, oh yeah, I know like X person that has PCOS. And, it's just like because it is so common that a lot of people, it affects, 1 in 5 to 1 in 10 people. So because it's so common, somebody does usually know someone that has it. And as long as your story like helps impact one person or make it relatable to one person, it's worth sharing.
Absolutely. So, anyone who is in North Carolina, she's a regional leader for North Carolina, sign up
Yes.
because you're in really good hands. So, do you have any final thoughts, tips, or anything else that you would like to share with everyone who's tuned in today?
I think what I would like to share, just to summarize everything we've been saying, is, utilize all the resources we have. I think, especially like as women, we feel like we have to take on everything ourselves and we have to do it ourselves, and that that it's not okay to ask for help. But, PCOS is something that's really complex and it's there's so many different ways to manage it. It's a lot about like trial and error, and then just figuring out what resources can help you and utilizing those and the community of people that we have.
I love that. Love, love, love that. So, how can our listeners connect with you through social media, website, or practice? Because I know after seeing this that there are going to be a lot of people who want to know where to find you.
So I am on Instagram and TikTok at pcos.holistic.coach. And then on YouTube and podcast and my website, you can just search PCOS Holistic Coach. And I have a mini course actually that's available to help. The mini course is about how to enjoy Indian food guilt-free with PCOS. So I cover how you can enjoy like your ethnic foods with PCOS. And then I also have another resource that's going to be coming out in spring 2023.
I cannot wait to check it all out.
Thank you.
I thank you so much for coming and sharing your expertise, but also for sharing your passion about the community, for the community, with the community, and really stepping up to make a difference as a patient and a practitioner. It means the world. And hopefully with people like you, we can encourage other practitioners to get involved and raise their voices as well. So thank you for joining me today.
Oh, well, thank you, Ashley, and thank you as well for taking the time to hear my perspective on everything.
Absolutely. And everyone, thank you for tuning in this afternoon. I hope you will join for more of our interviews. We have quite a few of them throughout the month of February, along with events, fundraisers, educational series, and our Teal to Red initiative on February 3rd, where we recognize the largest at-risk group of women for cardiovascular disease, women with PCOS. So have a great afternoon, everyone, and we'll see you again soon.